Hey guys, in this video I'm going to show you exercises for your shoulder and your arm after a stroke. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. A quick disclaimer is that none of this replaces medical professional advice and I do this in my personal capacity and do not represent anyone. So for these exercises, I need you to have a towel. You must be seated in a supported wheelchair, ideally with armrest and a backrest. And also you need a table to rest your arm or to do the exercises, as I'm going to show you in a while. So for the shoulder, we want to start off with the shoulder blade exercises, or this is what I call the scapular exercises. It is important to start with the scapular exercises because this is where a very weak arm, this is where the power tends to come back first, or in most cases, this is where you may be able to find some of these hidden contractions that is actually happening, but you may not be aware of. So it's good to actually have a feel of or get a movement sensation going on in your scapula before going down to the rest of your arm. So I'm going to show you two different scapular movement exercises, and just want you to try your best to do these movements. You may not be able to replicate exactly like how I'm doing, but just get a feel of this type of movements and just get some movement going on in your shoulder blade. So I'm going to show you my back view here. So this is just the weaker arm. So I want you to rest your forearm and your hand on the table here like this. And this is the portion that we want to focus on, okay? So take a look at this part when I'm going to move my shoulder. So for the shoulder blade, we're going to do two movements. One is an upward movement like this and one is inward like this. So we're going to go the upward first. So just take a look at this. What I want you to do is actually just like you're hiking your shoulder upwards this way. So just bring your shoulder towards this ear. This is what you're trying to do. And just relax, okay? So you can go up and hold it for about 3 to 5 seconds if possible. If not, just bring it up and down, but do it in a slow manner. And I really want you to close your eyes and feel this movement here. If you're unsure of what this movement feels like, then you can actually do it on your stronger side and take a look at how it feels like, and then just try to replicate it and up and down like this, okay? So up, hold for about 3 seconds if you can. If not, it's okay, just come back down slowly. So just go up and down, up and down. So this is the first movement. The second movement is I want you to imagine in the center of your spine, there is a ball here and both your shoulder blades are going to squeeze them together. So you're going to do this as a squeezing movement, but you're going to bring your shoulder blade in towards your spine, okay? So just take a look at this movement. I'm just going to retract my shoulder blade like this. You can also do it on your stronger side together, but focus more on the weaker side. So just retract like this and relax. Okay, so imagine there's a ball at the center of your spine. You're trying to squeeze this ball with your two shoulder blades, squeezing the ball and relax. So in like this, you can hold it for about 3 to 5 seconds if you are able to. If not, just in and out, relax and do it slowly. Okay, so in and out. Okay, so ideally you want to do this for about 10 to 15 repetitions between 3 to 5 sets, but if you can do more, go ahead and do more. If you find this video useful, do consider liking and subscribing to the channel and also signing up to my weekly newsletter, Rehab Recovery, for more insights like this. So the next exercise you're going to do is focusing on your shoulder, but we're going to do a flexion movement. So this is what we want to do. But this may not be something that you can start off with, so I'm going to show you different variations on how you can target this movement for shoulder flexion. So you want to sit upright in a wheelchair or a supported chair like this and put your arm and your hand, especially your forearm, on the table like this, and also put a towel over just to reduce the friction on the table. So first thing that we're going to do is you're going to reach forward, okay? So actually if you look at it, when you're reaching forward, you are actually increasing the flexion range in your shoulder. So for example, when you're reaching forward like this, your armpit is coming towards the table, right? Actually, this is actually a shoulder flexion, but it's in an indirect manner. So that's what we're going to target. We're going to use the help of your trunk and the help of your hand to do the shoulder flexion forward. Okay, so place your hand on a towel like this to reduce the friction, and using your trunk, just lean forward and slide your hand forward like this and come back. So you do not want to do the entire movement just with your trunk itself, but you want to do at least about 40% of the trunk and 60% of the hand. If you can reduce the reliance of the trunk and do more on the hand, that is the best. But just take note of your weaknesses and just do accordingly as you can do. Okay, so just lean forward like this and come back. So the towel is to help you to reduce the friction, lean forward and come back. Okay, do not slouch like this, but as you're leaning forward, look in front or look at the ceiling so that your trunk is upright as you're doing this movement. So just lean forward and back. So really control this movement and do it slowly just to get the quality of the movement better. So another variation of this is that you can use your stronger hand to put on your weaker hand like this, and using the stronger hand and the trunk and your weaker hand, you can actually push forward and come back. Okay, so this will be a little bit more easier if you're using a stronger hand to help, and you can actually see which of this exercise you prefer and start off with that first. Okay, so you want to do this between 10 to 15 repetitions, but do more if you are able to and your energy allows and there's not much of pain, and do between 3 to 5 sets in a day. You can do it 2 times a day also, but really be mindful of the pain and the energy level that you have before doing this for more repetitions and more sets. So the next variation for your shoulder flexion, we are going to go back and take this as my weaker arm now. Okay, so you want to sit upright, backrest in a supported chair like this, and you want to hold onto the weaker elbow joint here. Okay, so this is your stronger hand is holding onto the weaker arm here, and you want to rest your hand, the weaker hand, over the crease of your elbow on the stronger hand. Okay, so get into a position like this. Next thing what we're going to do is you're going to use your stronger hand to help you do about 50% of the work, and you yourself on the weaker arm doing another 50%, just raising it up like this and down. Okay, so going up slowly, really focusing on the muscles at this area of your weaker arm, the front part of your shoulder. Okay, bringing it up slowly and coming back down. So you don't need to go beyond 90 degrees because that's where you will get a bit uncomfortable and may even cause some pain. You don't need to go up to that level yet. Just about 0 to 45 degrees up like this and coming back down slowly. So if you really do not have any muscle strength at all, that's fine. Focus on the coming down portion. Okay, so sometimes coming down is where you're able to start activating the muscles first versus moving upwards. Okay, this is the eccentric phase that we are coming down versus the concentric, which is the going up. Sometimes the eccentric phase is where you are able to start firing up the muscles. So just come down slowly like this and go up. So same thing, about 10 to 15 repetitions, 3 to 5 sets. So the next variation is if you have a little bit more strength in your arm, then what we want to do is similar position like this, just resting your elbow here, forearm on the hand on the elbow crease of the weaker hand, of the stronger hand, and then the strong hand supporting the elbow. Now we're just going to go upwards using 90% of the power of your weaker hand. Okay, so stronger hand is really just supporting the joint here, just keeping it in place. Because what will happen is if you're going to do this movement, what is happening is that the entire weight of the arm is going to be resting on this weak shoulder flexors. So if you bend your elbow, you're actually reducing the length of the arm, and this is going to be a bit more easier. This is actually physics. If you have actually done physics courses, you may understand what I'm talking about. Basically, you're just reducing the length of the arm, you're reducing into half, and this actually requires lesser force for you to be able to go up and down. So that's why I'm asking you to bend your elbow and put it on your stronger arm, and your stronger arm hand is just helping you to guide this hand up and down, while 90% of the work is being done by the weaker arm. Okay, so this is the variation where if you have the most amount of strength, this will be beneficial for you. So using a weaker hand to go up and come down slowly. Same thing, 10 to 15 repetitions, 3 to 5 sets. If you'd like to support the channel, you can consider donating in my Ko-fi link, and the link is in the description below. So now we are going to move for the shoulder abduction. So this is the abduction range. Of course, I do not expect you to be able to do this, but we're going to show you a different variations to do it a little bit more easier. Okay, so same thing, you need a table and a towel here. You want to open up your hand in a sideways manner like this. Okay, if you're not able to open up this angle, that's fine. However much that you are able to open it up to, go ahead and do that as much as you're comfortable and pain-free. Okay, so for me, let's just put it this way first, and you want to rest your hand on the towel, the forearm on the towel, and using a trunk, same thing like the shoulder flexion, using a trunk, you want to use your trunk about 40% and 60% of your hand to do this movement of reaching this way. So as you're doing this, you don't need to go all the way out and actually your armpit have to touch the table. No, you don't need to do that because that'll be very painful for you. You just want to do a little bit of a movement like this just to open up your shoulder and actually get your muscles firing in a more active manner. Okay, So using the help of your trunk, just reach sideways like this and come back. Okay, so don't make it a trunk movement, but actually do it concurrently with your trunk and also your shoulder. So this is the first variation. Another variation that you can do, you can bring your hand slightly forward, using a stronger hand, put over your hand here, and continue to reach this way and back. Okay, so with the help of the towel, sometimes you can even use a plastic sheet to reduce the friction if it's a bit more easier for you. Using a stronger hand, your trunk, and your weaker hand to reach sideways in a shoulder abduction manner and coming back. Okay, so similarly to a shoulder flexion, you want to do this between 10 to 15 repetitions, 3 to 5 sets, but go ahead and do more if you're able to, and you can even do it twice a day if you're able to do it with your energy and your pain level. The next shoulder abduction variation that I have is sitting in a position like this again, and this is my weaker arm now, and using a stronger arm, what I want you to do is guide your weaker hand into the elbow crease here of your stronger arm, and your stronger hand is going to hold on to your weaker elbow. So what we are going to do is you're going to go like this, okay? You're basically like rocking a baby side to side, but we are going to use your stronger hand to push your shoulder outwards like this and come back in. So going out and in. You don't need to go and open beyond 45 degrees. That is actually not necessary right now. Just go slightly to the side and come back down. Okay, so this stronger hand is pushing this way so that the shoulder also opens up and coming back down slowly. So similarly to your shoulder flexion, if you're not able to go up because of the lack of power, focus on the coming back down phase. This is the eccentric phase of the shoulder abduction. So going up, you can help more from the stronger hand, and when you're coming back down, use more of the weaker power, the weaker hand, to really control the eccentric phase on coming down like this. Now, if this is not very challenging for you and you want to go one step higher, what I want you to do is putting your arm like this in a bent manner like this, just open it up to the side and come back down. So open it up to the side and come back down. Open it up to the side like this and come back down. So you can also put your arm like this so that you're just focusing on the shoulder and not moving much of your hand, so that it doesn't get you to use more force, but you're just going to focus sideways like this. Okay, so for both of this, you want to do about 10 to 15 repetitions, 3 to 5 sets. If you found this video useful, do consider watching this video where I break down all the exercises that you need to do for a complete arm workout after a stroke or neurological injury. Thank you, and I'll see you in the next one.